So your Medicare premium just went up again and you're starting to wonder, am I going to be able to afford this 5 years from now? Well, if you're on a Plan G or a Plan N, this episode is your warning and potentially your wake-up call.
It's the Howdy Neighbor Retirement Show.
Howdy Neighbor, I'm Michael Andrews with Andrews Insurance and Advisory, and you're listening to the Howdy Neighbor Retirement Show, where each week we tackle real-life questions about retirement, Medicare, and Social Security so you can head into retirement with more confidence and a whole lot less stress. But this week, back by popular demand, I might add, we're doing a full-blown Michael-atorial. Because these Medicare Supplement rate hikes that I've been seeing, they are not just a pricing cycle. There's something bigger happening behind the scenes with Medicare itself, and if you've got a Plan G or a Plan N, you need to understand what potentially could be coming next and how to protect yourself. So let's go ahead and get into it. So what I want to do is I want to talk to you about what is really going on with some of these Medicare Supplement rate increases. Every year I see folks getting hit with $20, $40, even $60 a month increases on their Plan G and some on their Plan N policies. And most people chalk it up to inflation or say, well, that's just how insurance works. But what if I told you there is a deeper issue behind all of this, and it's not just about a premium cycle or greedy insurance companies. It's built into the way that Medicare is beginning to change. And here's what I mean by that. Right now, Medicare is spending about $12,000 per person per year. But by the year 2050, that number is expected to almost double to somewhere around $24,000 per person per year. And that's not because of inflation. That is based on claims and utilization, what people are actually using Medicare to pay for. So you may be asking yourself, why is this happening? Well, if you go back in time to the early 2000s, the average Medicare beneficiary was about 74 years old. But by 2050, the average will be closer to 82. And the number of people over age 85 is expected to triple. So let me say that to you again. The 85 and up crowd is the fastest growing segment of Medicare. And they're also, well, they're the most expensive to insure. CMS is projecting that by 2050, 1 in every 5 Medicare beneficiaries will be 85 years or older. And why does that matter? Well, a 65-year-old Medicare costs the system somewhere around $8,000 to $9,000 per year. But an 85-year-old, well, that number jumps up to about $33,000 per year. And that is not due to inflation. That's because of more chronic conditions, more hospital stays, more Part B drugs, infusions, more skilled nursing care, all of it. More expensive care and more often. So what all does this have to do with Plan G and Plan N, you may be asking yourself? Well, potentially it could be a lot to do with Plan G and Plan N. Those plans are designed to cover almost all of what original Medicare doesn't. In fact, Plan G covers 100% of the Part A coinsurance and 100% of the Part B coinsurance after you hit your small deductible. And Plan N is pretty close to the exact same thing. It just has a couple minor copays that go along with it. But here's the problem with these plans. These plans were priced based on 65-year-old people and the risk that they typically offer towards the insurance companies, not an 82-year-old. They were built for a younger, healthier Medicare population. But now they're being asked to absorb the claims that come from aging, high-cost population, and that is a losing game. This is what's known as the cost curve, and it's beginning to bend hard. So if you're an insurance company and you're paying out more in claims than you're expected when someone first bought the policy at 65, what do you got to do? You've got to raise the premiums, and this is not optional. So these premium hikes that we're seeing, they're not random. They're baked into the system, and they're probably going to continue. And here's the part that really matters for you guys out there. Plan G and Plan N both have design flaws. It's not that they're bad plans. They are great. They cover everything. They are the Cadillac of health insurance, in my opinion. But Medicare and CMS can look at them and say they may be too generous in a system that's getting more and more expensive by the year. They pay for too much of the members' out-of-pocket cost, and that creates zero incentive for low utilization. There's no skin in the game, which that means higher claims, and higher claims mean higher premiums. So you may be asking yourself, what do you do? Well, there are a few smarter ways to approach this. Number one is a High-Deductible Plan G. It's one of the most underrated Medigap options out there. It gives you the same full coverage after you meet a deductible, but it keeps your monthly premium lower, and it encourages people to think before they rack up those huge claims. Because the truth is, maybe not everyone needs to be on a $200 a month Plan G when they could be on a $60 a month High-Deductible Plan G and be just fine. There's also the option of something new called an Innovative Plan G. Like I said, these are newer versions of Plan G that include cost sharing in the form of copays or limited coverage for certain services. These are very, very new and kind of a creative way of looking at the business block where they're trying to get people to be less likely to overuse care, which is hopefully going to keep premiums more stable. These designs may take a little more time to explain, but if you want to protect your premium in the long run, they're definitely worth looking into. Now, let me say this real quick. For some people, Medicare Advantage may also be a path worth exploring, especially if your budget is tight and Medigap premiums are getting out of hand. Advantage plans do have trade-offs like network and prior authorizations, but they also have out-of-pocket limits, and many come with $0 premiums. And I'm not in any way saying that Medicare Advantage is the answer to Medicare cost curve, because it's not. But if you have been priced out of your Medigap plan and you want some protection from runaway premiums, it might be worth a side-by-side comparison. But at the end of the day, here's what I want you to take from this episode. These rising Medigap premiums aren't just bad luck. They are a result of a healthcare system that is getting more and more expensive, and it is happening fast. And because these plans were built for younger, cheaper risk pools, it looks like it could be something that we're going to see continually into the future. So don't just chase the lowest premium when you turn 65. Think about what the premium will look like when you're 85. The winners 20 years from now will be the people who picked a plan that was built to last, and not just one that looked cheapest at the starting line. I know that might be a hard pill for some of you all to swallow, but it looks like this is the direction that Medicare could potentially be moving towards in the future. So that is going to wrap it up for today's episode. Today's Michael tutorial was all about the rising cost of Medicare Supplement plans and why it's not just inflation or bad luck. We talked about what's really driving those rate hikes, including Medicare's exploding per person spending, an aging beneficiary population, and why plans like Plan G and some Plan Ns are getting hit the hardest. Then we looked at smarter, more substantial alternatives like High-Deductible Plan G and innovative plan designs with built-in cost sharing, and when Medicare Advantage may be worth at least comparing if Medigap has gotten too expensive to maintain. Before we go, I do have one more question for you though, and that is, are you confident with your retirement plan? It doesn't cost me anything to take a look, but not letting me, man, that could cost you thousands. So if you're ready to take this relationship to the next level, you can call me or you can text me at 918-842-7379 or head on over to andrewsadv.com and click on my work calendar to schedule a phone call that works for you. And don't forget, the full replay of today's episode drops every Tuesday evening on the Howdy Neighbor Retirement Show Facebook page and YouTube channel. Give it a like, leave a comment, and share it with a friend who could use some good, friendly, neighborly advice. Thanks again for listening, and we will see you all next week right here on the Howdy Neighbor Retirement Show. Thanks.
It's the Howdy Neighbor Retirement Show, helping you plan so your money will grow. No need to worry, we'll make it clear. Medicare and retirement right here.